Proprioceptive neuromuscular facilitation techniques, or muscle energy techniques, have been used for years by physiotherapists and osteopaths, using the reciprocal inhibition or post-isometric relaxation principles. From a combined movement point of view, if you imagine you have a scenario of somebody with severe right-sided neck pain with a prime combination of right side flexion extension, suggesting an anterior capsular stretch pattern, or hypertonicity of their anterior musculature, then in this very severe position you would start treatment in the opposite corner, in left side flexion, and in that position, using reciprocal inhibition, you would use the posterior muscle group, so you would do resisted extension and right side flexion. After a number of treatments with this approach, you would find that the pain has reduced, and then it becomes acceptable to treat the person in their prime combination of right side flexion extension. So in right side flexion extension, you would then move to doing a post-isometric relaxation technique. So you would be using the agonist, the muscle in spasm. So in right side flexion extension, you would do resisted flexion and left side flexion, so that they would be working their anterior muscle group. In terms of the technique, then it's very useful to use terms like "don't let me win" or "hold it there," and then you control which muscles work and in which direction. You have the added advantage of holding the segment locally. Ideally you want to be able to just palpate muscle contraction, which arbitrarily is about 30% of maximum voluntary contraction, and again holding a contraction for 6 to 10 seconds seems to be the appropriate amount of time to hold the contraction, and you repeat the number of contractions, as many as necessary, but that's often 3 times. If you can coordinate a contraction with the relaxation you feel with exhalation, then that helps, and also coordinating the muscle contraction with the directions that the eyes are pointing. So if you point down and across, then the muscles that would encourage that movement will be increased in their muscle tone. So coordinating those features allows you to make muscle energy techniques or proprioceptive neuromuscular facilitation more effective. More detail on the following video. Imagine the patient has pain going ipsilaterally into extension and side flexion, suggesting a superior capsular stretch and potentially muscle spasm and pain of the anterior muscles. A post-isometric relaxation technique may be too painful, so let's start with a reciprocal inhibition technique using the posterior muscle group. In that position you put them into flexion, left rotation and left side flexion of the upper level. In this position now you're making the posterior muscle group contract, so you fix the pelvis with your left hand in this case, and then you're pushing them away from neutral, asking them to resist the movement. So "don't let me win," hold it there, and you'll be able to palpate an isometric contraction of their posterior muscle group. Hold it for 6 to 10 seconds and then sneak them further into range. Again, hold it there, "don't let me win." 6 to 10 seconds, and then relax, and then you can further into range until you feel another resistance point, and again hold it there, "don't let me win," and then relax, and you'll see an increase in range that way, using the posterior muscle group with a reciprocal inhibitory technique. You then sit them up and retest, and you'd find that their prime combination was more mobile and less painful. There'd come a point then when it was acceptable for you to move into that position, so you're now going up into extension, right side flexion, and taking them further into that range. So in this situation you'll be using the agonist, the anterior muscles, and working them to produce a post-isometric relaxation technique. So in that position it's a case of "don't let me push you any further," You're taking them further from neutral and they resist you, and then as they relax again you can go further into range, don't let me win. You're trying to push them further away from neutral and they're resisting. And then again relax, you can go further into range then, don't let me win, hold it there, 6 to 10 seconds and relax. And the anterior muscle group then will experience a reduction in tone.